For the academic procession. Just to procession is led by a deputy registrar, Mr. Kola. We have the Dean of Agric.
There to be champions.
Deans of faculties. And that is the registrar coming onto the high table, followed by the deputy vice chancellor, plus the lecturer, Professor Mrs. Adeyemo. We have the vice chancellor, Professor Razak Olatunde Rom-Kalilu.
Only Can we have our seats? May I humbly invite the Vice Chancellor, Professor Razak Olatunde Rom-Kalilu, to the podium to read the citation of Professor Florence Oluyemisi Adeyemo, the presenter of the university's 71st inaugural lecture titled Public Health Nursing as a Frontline Profession in Preventive Health Care, and to declare the lecture open. The Vice Chancellor, sir.
The citation of Professor Florence Oluyemisi Adeyemo. Florence Oluyemisi Adeyemo was born on the 5th day of August 1956 to the families of late Mr. Ezekiel Ibikunle Olugbami and Mrs. Esther Olugbami of Ekinriade, Ijumu local government area of Kogi State. She attended Holy Trinity Primary School, Kano, between 1963 and 1968, and St. Louis Secondary School, Bompai, Kano, between 1969 and 1975. She then proceeded to the School of Nursing, Ilorin, between 1975 and 1978. She later attended the University of Ibadan from 1981 to 1984, where she obtained her bachelor's degree in nursing. She was registered by the Nursing and Midwifery Council of Nigeria as a registered nurse educator in 1986. She did her midwifery training at the School of Midwifery, Yemetu, Ibadan, between 1986 and 1987. Thereafter, she studied at the University of Ibadan for the master's degree in nursing between 1993 and 1995, and the doctoral degree in health education from 2000 to 2004. Furthermore, she had another professional certificate in public health nursing from the Obafemi Awolowo University, Ile-Ife, in 2005. She is a family planner and occupational health nurse. She became a fellow of the West African Postgraduate College of Nursing and Midwifery in 2007. Florence Adeyemo started her professional career as a staff nurse under the Ministry of Health, Ilorin, and worked in the General Hospital, Omoaran, between 1979 and 1980. Later at Ring Road State Hospital, Ibadan, between 1980 and 1982. She did her NYSC at Ibadan School of Nursing, Eleyele, in 1985. She worked as staff nurse at Adeoyo Maternity Hospital and the Directorate of Nursing at Ibadan between 1987 and 1989. Furthermore, between 1987 and year 2003, she worked at the School of Nursing, Oshogbo, as a nurse tutor. Then she moved to School of Nursing, Eleyele, Ibadan, and Oyo State College of Advanced Nursing Studies, Oyo, where she rose to the rank of Chief Lecturer. Florence Adeyemo joined the services of LADOKE AKINTOLA University of Technology as Lecturer 1 in 2003 and rose through the ranks to become Professor in 2016. Professor Florence Adeyemo is a tenacious scholar with over 80 scholarly publications. She served as acting head of Department of Nursing Science between 2005 and 2007, and again from 2016 to 2018. She was a member of the Faculty Postgraduate Committee that served on that committee in year 2006. She was Dean, Faculty of Nursing from 2024 till the present. In addition, she had also served at the college level and the university levels at various times in different committees. Professor Adeyemo is a member of resource person on accreditation of nursing programs to the Nursing and Midwifery Council of Nigeria from the year 2007 till 2022. Member ad hoc accreditation committee of National Universities Commission from 2007 till date. In addition, she is chairman, Education Committee of West African Postgraduate College of Nurses and Midwives from year 2025. Professor Florence Adeyemo's academic influence extends beyond LADOKE AKINTOLA University of Technology. She assisted in developing curricula for many departments of nursing in Nigeria, and also established and assisted in establishment of Department of Nursing in many parts of the country. She has also mentored and supervised over 300 undergraduate and 25 master degree and doctoral degree students, both in this university and other universities. In addition, she had served as external examiner in 15 Nigerian universities. Moreover, she is a member of several professional bodies that includes National Association of Nigerian Nurses and Midwives, Association of Nigerian Nurses Educators, Professional Association of Public Health Nurses in Nigeria, Association of Public Health Nursing Practitioner, and Fellow of West African Postgraduate Nurses and Midwives College. Professor Adeyemo was happily married to late Deacon James Olatunde Adeyemo till December 2025, when death did them apart. The marriage is blessed with children. Ladies and gentlemen, I will invite Professor Florence Oluyemisi Adeyemo to deliver the 71st inaugural lecture of this university on behalf of Faculty of Nursing. I invite her as I declare the inaugural lecture, the 71st inaugural lecture, open.
Thank you, sir. The Vice Chancellor, sir. The Deputy Vice Chancellor, Academics and Innovation. The Deputy Vice Chancellor, Strategy and Development. The Registrar, the University Board, sir. The Provost, College of Health Sciences. The Provost, College of Agricultural Sciences and Renewable Natural Resources. deans of other faculties, postgraduate school, and student affairs, my Lord spiritual and temporal. I remember you today and always, my husband, Deacon Olatunde Adeyemo, who made me what I am, and today, by the grace of God, members of my nuclear and extended family, esteemed guests, friends, and relatives, greatest LADOKites, gentlemen of the press, distinguished ladies and gentlemen. Mr. Vice Chancellor, sir, I thank you for giving me the privilege to present this inaugural lecture. I give God Almighty the honor and adoration for granting me the unique opportunity to deliver this inaugural lecture. Public health nursing is an act and science of nursing that combines both preventive and curative nursing function as a total public health entity through the promotion and maintenance of health and prevention of diseases from cradle to grave. The public health nurses are one of the healthcare professionals who have risen to the demand of treating patients and saving lives to the detriment of their own health and well-being. My career as a public health nurse. The Vice Chancellor, sir, my journey into public health nursing began after being employed to LADOKE AKINTOLA University of Technology, when I have to teach public health nursing. So, despite the fact that I have my master's in community health nursing and my PhD in health education, I still felt I need something I should know about the course. So I received lecture in OAU and sat for the exam. And my public health nursing career started with immense contribution of my quota, firstly to the Department of Community Medicine, when it started at the then LADOKE AKINTOLA Teaching Hospital, Oshogbo. I have worked in several clinics in OGBOMOSO, Oshogbo, and requested for a primary health center from the Surulere local government area of Oyo State. And the Department of Nursing was given Ikolo Primary Health Center with 10 villages attached to it. And our services in Ikolo include antenatal services, delivery, health education, family planning services, health, infant welfare clinic, treatment of sick people, referrals, home visiting, and mobile clinics. My path crossed in public health nursing with Chief Mrs. Adeyemo Oluwatayo, who was then the chairman of Professional Association of Public Health Nurses in Nigeria. We exchanged ideas before I became the board member of West African Health Examination Board. As the public health community units of the Department of Nursing, I and my colleague work assiduously with primary and secondary schools in both Oshogbo and Ogbomoso. We carry out services like inspection of pupils, appraising their health status, monitoring their growth, supervising school meals and vendors, detecting and treating abnormalities in school children, raising awareness about the prevention of diseases among pupils and their teachers. My impacts and that in the schools are found in Laro, Timeyin School 1 and 2, Oshogbo, Ashubiaro, AUD Middle School, Oshogbo, Isale Agbara Girls High School, Oshogbo Grammar School, Lautech Secondary School, Ogbomoso, ADEYEMO Nursery and Primary School, District Community Primary School, OGBOMOSO. In conjunction with my colleagues, we also work as industrial occupational health nurses at Moye Petroleum Industry, Osogbo, Tunes Farm Industry, Osogbo, Lubricom International, Ilorin, HMA Medical Limited, Ilorin, Boraj Pharmaceutical, Ilorin. We determined the health status and discovered that many of the workers manifested non-communicable diseases that are known to them. And we treat some, we referred some to both states and teaching hospital, depending on their diagnosis. I introduced public health nursing to many universities and also assisted in training lecturers. I had the privilege of collaborating with the environmental health officers and notable individuals and communities across many parts of Nigeria. I and my colleagues were able to work with government institutions on public health nursing, and we are able to bring public health nursing into limelight. We joined the Society for Public Health in Nigeria, which consists of different public health professionals. These collaborations have been instrumental in shaping my view in collaboration in the improvement of health outcome. Who is a public health nurse? Mr. Vice Chancellor, sir, a public health nurse is a person who passed through the School of Public Health Nursing and passed the prerequisite examination, registered and licensed by the Nursing and Midwifery Council of Nigeria. Todd described the public health nurse by virtue of her training as a polyvalent nurse who will function within the community, inside and outside institutional settings, like health centers, hospitals, factories, seaports, schools, among others. Her primary focus is the family as a unit. Public health nursing as frontline professional in preventive healthcare. The healthcare industry in any country is integral to the physical and economic health of every person. Therefore, healthcare professionals are needed. They are vital in enacting and enforcing policies and keeping the system running effectively. More than 1 people across the world have had their health affected due to various diseases and pandemics. And it also affects the healthcare providers, such as the public health nurses and other areas of specialty in nursing, fighting on the front line to safeguard the health of everyone affected. Nurses, especially the public health nurses, provide care for patients in a variety of settings. Nurses' role ranges from direct patient care, case management, to establish practice and standards, and developing quality assurance procedures. Public health nursing played a critical role in primary healthcare delivery, often the first and probably the only health worker a patient will see. They face a lot of challenges in their battle to save life. These healthcare professionals are heroes that do not wear cap, but play an extremely critical role in our lives by providing patients with preventive medication, preventing disease from spreading, educating people about prevention, cures, and other such tips, disseminating information about how to live a healthy life, having the drive to help people, and being empathetic. Characteristic of a public health nurse. The public health nurse assists in the treatment of pandemics and epidemics such as Ebola, severe acute respiratory syndrome, and COVID-19. They provide good patient care and protect their own physical safety. Public health nurses are consulted and involved in decision making. Their work in the front line is vital for current as well as future management of diseases and pandemic. Public health nurses give individuals, families, and friends. They encourage clients by assisting them in generating income to maintain their families and comforting them in time of family crisis. They give knowledge and information to all their patients, which in turn decrease fear and anxiety of illnesses, especially the preventable ones. They also encourage patients to seek information, clarify, and consensus with the purpose of achieving greater certainty. The role of public health in preventive measures. There are more than 8 areas in which the public health nurses do operate. These are primary health care, school health, health education, reproductive health, community midwifery, care of the aged and adolescent, occupational health, port health, domiciliary nursing, domiciliary midwifery, and so forth. The public health nurses and other workers organize programs to achieve health services delivery within the community. During pandemic, they exhibit leadership qualities in providing services. The role of public health nurses in the attainment of related reports, compiling statistical data so that care can be sustained and there is no gap in the actualization of the MDGs 4, 5, and 6. Repositioning public health and community health nursing. There is a need for our government to invest in nursing, especially the public health nursing. The profession must be transformed to bring about changes that will be effective in patient care and outcome. Public health has the potential of making difference in this era of increasing challenges and innovation if opportunities are provided. A bold vision will bring about changes in education, leadership, and healthcare services. The repositioning of public health nursing will bring about advances to education, clinical skills, complexities of work, and commitment to patient care. Many scholars in Nigeria have been trying to reposition public health and community health nursing in Nigeria by sub-specializing in different aspects of public health nursing. Many postgraduate programs in our university sub-specialize in primary health care and occupational health nursing. LADOKE AKINTOLA University has moved a step further in public health nursing by specializing in health and disaster nursing, while in community health nursing, sub-specialized in cardiac nursing and integrated management of childhood disease and illnesses. Mr. Vice Chancellor, sir, let me at this junction present some of my contributions I have made to the body of knowledge in my own area of specialization, public health nursing. My research activities focus on many areas of public health nursing. These are adolescent health, health education, school health, maternal and child care, reproductive health, community psychiatric nursing, disease management, and prevention. Adolescence is a transitional period that begins at the onset of puberty and extends to the point of entry into the adult life. The teenage period is a mixture of joy, fear, disappointment, frustration, conflict, anxiety, pressure group, restlessness. Many adolescents with stable home and family life can resist the temptation of experimentation of drug and alcohol. Adeyemo studied drug and alcohol abuse among adolescents, implication for nursing care. She observed that widespread use of substances such as alcohol, marijuana, cigarettes, prescribed drugs among our adolescents, which may be as a result of dehumanizing problems, psychosocial stressors, socioeconomic problems, and war problem. Youth-friendly program is an aspect of expanded life planning education as a strategy of improving the reproductive health, services, and sexual behavior of our students. Adeyemo and Amego studied the knowledge and attitude of adolescents on youth-friendly program in selected school in Ovia Northeast local government. The results reveal that many students are knowledgeable about youth-friendly clinics, but only 43.4% of the respondents attend youth-friendly clinic, out of which 32% seek medical treatment from youth-friendly clinic. 92.6% of the respondents seek advice of reproductive health issues from their friends. Study noted that the attitude of respondents is positive. Malaria is an acute infectious disease caused by protozoa. Salako explained that in many parts of Africa, the unofficial healthcare system and their operator exist side by side with the official health system. This official health system include traditional herbal healers, spiritual healers, and patent medicine vendors. Ogundele and Adeyemo studied the effectiveness of health education program on patent medicine vendor practice of treatment and prevention of malaria in Ibadan. Our study showed that health education intervention program has a significant effect on the treatment practice of malaria among patent medicine vendors. Ogundele and Adeyemo discussed the nutritional problems as health impediments to educational achievement of the school-age child, and stated that the nutritional status of school-age children is crucial to the importance of determining their future prevalence of adult diseases such as ischemic heart diseases, hypertension, etc. Failure to address nutrition of school children will have great negative impacts in addressing adult diseases. The nutritional status of school-age children in Nigeria has improved tremendously in the last decades. Adeyemo and Chukura studied the parental socio-economic status as a correlate to significantly influence the health status of their wards in both public and primary and private schools. And malnutrition is significantly higher in public schools than in private schools. School feeding was introduced by the Abeokuta and found that majority of these pupils received school meal services during the regime of Governor Oyinlola in 2006. And Governor Aregbesola continued with this program in 2010. In some states, food meals are subsidized. Oyo State of Nigeria employed the services of food medically prepared manner. Adeyemo et al. Investigated the relationship between nutrition and disease found that the pupils in public school predominantly consumed energy-giving food, 96.6%. Whereas private school had more balanced diet, consuming 83.5% energy-giving food, 9.3% body-building food, and 72% of protective foods. Anthropometric findings shows marginal differences between the two types of schools, with slightly higher mean height and weight in the private school than their counterparts. Disease pattern indicates a higher prevalence of skin infection, wound, eye problem, and ringworm in public schools, while private schools recorded lower rates and fewer disease types. Adeyemo and Chukura carried out a survey on oral hygiene practices and occurrence of dental caries among undergraduates in OGBOMOSO, Southwest Nigeria. They observed that only 56% of students brush their teeth once a day using either toothbrush or chewing stick, and replace the brushes every 6 months or when it gets spoiled. Lastly, majority of students do not at any time visit the dentist for oral examination and treatments. Makinde and Adeyemo et al. Studied perception of pregnant women attending antenatal clinic on the usefulness of prenatal exercises in Oshogbo, Osun State. Finding revealed that majority, that's 74.6% of the respondents are practicing exercises during pregnancy. And there is a significant relationship between faster labor and preparation for labor endurance as perceived by the respondents. And other usefulness of prenatal exercises are relief of fatigue, swelling, and backache. Olaogun, Anyodiran, Obijuawa, and Ayeni and Adeyemo carried out assessment of the knowledge and acceptance of tetanus toxoid and hepatitis B vaccine among pregnant women in Nigeria. Findings revealed that 96% of the respondents are aware of maternal immunization program, but only 85% complete the 5 doses. In maternal and healthcare Gambian experience, they noted that male involvement in improving maternal health in Gambia has not been fully embraced and incorporated into maternal health services. The factors affecting male involvement in maternal health include unconducive facilities to ensure privacy, long waiting time in the antenatal services, and also the attitude of the health workers. Adeyemo and Enugu studied the determinants of maternal mortality in Yewa local government, delay in accessing healthcare services, poor coverage of health facility, investment of public in the health sector, and non-availability of drugs. Adeyemo and Amegeme assess the utilization of health services for reproductive health problems, awareness and utilization of health services. Secondly, there is a significant relationship between students' attitude and the utilization of healthy store, private institution, or alternative therapy for their reproductive health problem. And the barriers to the utilization of government health institutions include fear of seeing those they know, attitude of the health workers, and the cost. Adeyemo and Okonlawon assessed the knowledge of HIV/AIDS, sexual behavior, and risk perception of students of tertiary institutions from Atisbo local government in Oyo State. Finding reveals that the respondents are highly knowledgeable about about HIV/AIDS, but they could not perceive any risk in unprotected sexual intercourse with many sexual partners. Amegeme and Adeyemo determined the knowledge and attitude of nurses towards community psychiatric nursing. Results showed that the respondents are highly knowledgeable and their attitude is positive. Further study revealed that there is a significant relationship between knowledge and attitude of respondents towards community psychiatric services in Edo State. Adeyemo and Okpala studied the knowledge and attitude of people living in Ogbomoso with COVID-19, and findings reveal that their knowledge is high. The sources of information are radio, friends, television, relatives. Further findings reveal that the attitude was positive. Factors influencing the participant attitude are educational background, awareness raised by health workers, and psychosocial support. Hypothesis tested revealed that only educational status have significant relationship with the attitude of participants towards COVID-19. Adeyemo et al. Studied the incidence of malaria infection among undergraduates of University of Benin City. This study indicates that malaria is high among the 100 and 200 level undergraduates, but more common among the 200 level male students. Records shows that the common drug prescribed for malaria in the University Health Center are Lumetan and quinine tablets. Iron and folic acid are also given. Mr. Vice Chancellor, sir, in conclusion, the public health nurses play many roles in the health sector and are reactive and technical solution to specified problems and ensure sustainable approaches. Our study reveals that different areas of work in public health nursing which we need to intensify efforts, especially prevention of both communicable and non-communicable diseases, improving the health status of pupils and students, and improving maternal and child health nursing. Public health nursing have made the greatest impact in public health services and health intervention, especially during Ebola and COVID-19 pandemic. Many public health nurses describe all aspects of their work as enjoyable and rewarding because many of the patients improved. And over time, number of infection and death declines. They also receive gratitude from patients, their families, and wider society. Particularly, if ever they work in pandemic situation, there should be standardized content of sexuality education so that every student will know what is appropriate. Adolescents should be discouraged from seeking sexuality, manage their emotion, build their self-esteem, and engage in activities that will modify their behavior. Relevant health authorities in the country should consider a way of integrating the patent medicine vendor into the peripheral streams of healthcare services with sound monitoring and supervision. There is need for learning nutrition in school so that the children will be well fed and when they are healthier, they will learn better. There is need to enlighten the public about tetanus toxoid and hepatitis B vaccine to ensure that all pregnant women receive it to reduce maternal and neonatal mortality and morbidity. There is a need to encourage nurses to enter personal relationship with patients in the community, which is necessary for rehabilitation. Individuals should be encouraged to implement measures that will improve their health care and career. Yours is the praise and mine is the victory. I pay special tribute to my late husband and benefactor, Deacon James Olatunde Adeyemo, whose unwavering support laid the foundation of what we are celebrating today. And I would like the audience to please stand up for 1 minute silence for my husband. Thank you, sir. And Maz. His encouragement, sacrifice, and belief in my education remains unforgettable. I'm deeply indebted to LADOKE AKINTOLA University of Technology for molding me professionally. I'm grateful to the late Professor A.M. Salahu, who employed me and gave me the opportunity to contribute to knowledge and service to humanity during his tenure. I'm grateful for his fatherly advice that shaped my life. I appreciate Professor B.B. Adeleke for giving me the opportunity to develop nursing during his tenure and did not deprive me of the opportunity of bringing innovations to the Department of Nursing. I also owe Professor Moshood El Nassar gratitude for his support. I'm most grateful to Professor Logunde, who wiped away the tears on my face when I was frustrated and also gave me an enable environment to bring innovation and contribute to nursing knowledge in the Faculty of Nursing and ODLC. I am grateful to the current Vice Chancellor, Professor Rom Kalilu, for entrusting the leadership of the Faculty of Nursing into my hands and providing me with administrative support to coordinate the activities of the faculty. I thank the DVC Strategic and Development, Professor Ogunkunle, and DVC Academics and Innovation, Professor Araromi, for their administrative support. My sincere appreciation goes to the registrar, Mrs. Olayinka Balogun, the bursar, Mr. Koinde Olatokun, the university librarian, Professor Funke Ebijua, the acting deputy director, audit, Mr. Ismail, for adding values to my administrative experience. I also appreciate past vice chancellors, provost deans, and administrators who provided me environment for growth and innovations. I acknowledge my mentors, colleagues, the professional bodies whose guidance and collaboration strengthened my academic journey. I'm indebted to Professor Olatunbo Osun, the then Provost of College of Health Sciences, Osogbo, and Professor P.O. Akiwusi for their roles in the establishment of the Department of Nursing. I'm grateful to Professor Obisheson, the first Chief Medical Director of LAUTECH Teaching Hospital, OGBOMOSO, for building a faculty of nursing, which unfortunately we are unable to possess all. I'm very grateful to Pastor Professor J.O. Amowo for his guidance and support. I recognize the immense contribution of our current provost of College of Health Sciences, LADOKE OGBOMOSO, Professor A.I. Bello, and I appreciate the past provost, Professor Adeyemo, sorry. I acknowledge the significant roles played by Prof. the PGS board, who supported our faculty and did not allow our postgraduate programs to go into extinction, including Mrs. Olojede. Your destiny will not be truncated. I want to acknowledge my mentors, Professor B.O. Ogundele, of college and nurse. For their representative, if they are here, please, they should stand up. Thank you very much. I'm also grateful to the former registrars of West African Health Examination Board, Dr. Uswala, Dr. Ihunda, and the current registrar, Mrs. Oladejo. I appreciate the members of my family, both immediate family, extended family, and my in-laws. Please, you can stand up for recognition. Thank you very much. I'm indebted to my husband's friends, Mr. Lukman Abiola, Pastor and Mrs. Mosaku, Mr. Akinlade, Obatunji Adeleke, the Onirawo of Irawo, Mr. Oyewole, Mr. Oladejo, Mr. John, Mr. Taiwe Adeyemo, Pastor Olugbode, who has been standing by me since the death of my husband. I'm most grateful. I'm also grateful to Pastor and Mrs. Shombotunde. I appreciate the pastors and members of Winners Chapel for their love and support after the demise of my husband. I'm especially grateful to the state pastor, Pastor Olarewaju, and all other pastors. I express my gratitude to all the pastors and ordained workers of Living Faith, Ogbomoso. Please stand up for recognition. Thank you, sir. And also, I thank all members of follow-up units with the leader, Brother Temilade, for coming. I express my gratitude to members of Christ Ambassador Evangelistic Team, who has always been my support in time of crisis. I appreciate the President, Mr. Remi Salami, and others. My sincere appreciation goes to my students. Both undergraduates and postgraduates, both in LAUTECH and outside LAUTECH. Your achievement remains my greatest academic reward. Finally, I thank everyone who honored this occasion with their presence. May the joy of the Lord be their strength. Thank you, sir, Mr. Vice Chancellor.
I hereby declare the 71st inaugural lecture closed.
Peace in the mountain, your promotion of applied sciences. See the spectrum ni wọ́n, aṣíwájú ni wọ́n, aṣíwájú ni wọ́n, aṣíwájú ni wọ́n. Ipò aṣíwájú l'Ẹlẹ́dùmarè fún wa nípínlẹ̀ Ọ̀yọ́. Ìpínlẹ̀ Ọ̀yọ́ ẹ jẹ́ ká ṣe gírí, ọmọ Ọ̀yọ́ ká tẹpá wa mọ́ṣẹ́, ká bára wa sọ̀rọ̀, ká sòdodo, ká ṣohun tó tọ́ tó dára nígbà gbogbo, níbi gbogbo fún ìpínlẹ̀ Ọ̀yọ́. Onírẹ̀yìn o, lójú mi, onírẹ̀yìn o, onírẹ̀yìn o, nípa tèmi, onírẹ̀yìn o. Èmi aṣohun tó tọ́ tó dára nígbà gbogbo, níbi gbogbo fún ìpínlẹ̀ Ọ̀yọ́. Aṣíwájú ni wá, aṣíwájú ni wá, aṣíwájú ni wá.
Nigeria, we hail thee, our only native one. Though tried and tongue may differ, in brotherhood we stand. Nigerians old and proud to serve our sovereign motherland.
And affordable reading glasses today to see the difference. 06-489-9614 for more information.
Please let's remain standing while the Vice Chancellor leads the academic procession out of the hall.